Shortage of doctors, especially in rural areas, is causing patients to go to great lengths to get care. They may have to drive for hours or wait months to see a primary care physician.
The problem isn't new and is expected to get worse as baby boomers retire. In tonight's News 8's Investigates report, Mal Meyer shows us what area healthcare systems are doing to fill the need for doctors.
Mike and Martha, Trempealeau, Eau Claire, and Jackson counties have the worst shortages in the state. In these three counties, they need 10 more primary care physicians to fill the need. My investigation into primary care doctor shortages found there are many reasons why providers are not able to fill these spots. After completing her residency in Denver, Colorado, Dr. Kim Breidenbach wanted to come back home to the Dairy State.
It has been a joy to practice in a rural setting.
While she enjoys her work, days can be long.
And that's okay. That's good, but it gets tiring.
She's one of only 3 physicians at Gunderson Health System's Whitehall Clinic.
When one person takes time off, other people are picking up a lot of extra load, and so everybody's working hard all the time.
There's no one else to fill in, and no one else to call on when doctors need help caring for their patients. It's one of the many reasons why some doctors don't want to work at rural clinics.
And so I think people maybe are fearful of that, managing little more complex cases just because our patients don't want to travel as much to the larger city.
They feel the need to not only be a physician, but a specialist, even though that's not their training.
We really do have to work hard to keep apprised of the newest and greatest in medicine, because our patients will go see the specialist and come back and want to be educated by us and know our opinion.
All of these issues combined create a hard sell for medical systems looking to recruit physicians to these shortage areas.
Keeping them here is the next challenge.
We can have very stable physician staffing in one area, and then because they're small groups, you lose 1 or 2 doctors to retirement or resignation, and then all of a sudden it's a real hardship for that community.
In the coming years, the problem will reach a tipping point.
So we're finding that as the baby boomers retire, it might take 2 younger clinicians to replace that person who's retiring. So that makes the shortage even more accentuated.
Which is why medical providers like Gunderson Health System and Mayo Clinic Health System have doubled down on their recruiting strategies. Both are looking for doctors who may have rural roots or have spent time studying in these areas during their training. Doctors like Jody Breska.
Growing up on a farm and being so involved with the rural community and just feeling like I reaped the benefits of that, I wanted to give back to a similar type of community.
Her colleague, Dr. Bert Hodis, was an unlikely fit.
I'm kind of a city guy.
But he came to love the area, leaving a busy practice in St. Paul to move to Arcadia. He's made it work.
Maybe there aren't as many restaurants, maybe there aren't as many shopping places, but I'm not a big shopper. And my wife's a good cook.
It's this kind of eagerness to adapt that the 2 health systems are looking for in candidates.
Because that's the other thing that patients don't want. They don't want to get familiar with a primary care clinician only to have them leave in 2 or 3 years.
But they know that recruitment can't be the only solution to filling these shortages.
We've seen more residency programs focusing on rural practice, and that brings about more physicians that are interested.
One program hopes to show prospective doctors what the practices are like even earlier. After completing their bachelor's, medical students may apply for the Wisconsin Academy of Rural Medicine, known as WARM. It's one of the very few programs of its kind in the state.
Our job is to work with medical students who feel that they might be interested in going into rural areas, and we try to nurture that.
With sites in La Crosse, Green Bay, and Marshfield, they have about 25 students per year statewide. 91% of graduating students have come back to Wisconsin to practice.
A little over half of the people that have gone through the program go into primary care, and interestingly, 1/3 of the people that trained in the WARM program go back to their hometowns to practice medicine.
She would like to see other medical providers and colleges create similar programs to show future doctors the benefits of practicing in rural areas.
Being able to be the doctor in the community, but also go to church and go to the grocery store and do everything else with the people who live here.
At the end of the day, I usually feel good about the interactions that I've had and hopeful for the next day.
Dr. Lansing says she hopes to see WARM go on to reach younger and younger students. There is one program, the Health Science Academy in La Crosse, that prepares high school juniors and seniors for jobs in the health science industry. These students shadow healthcare professionals and get an area mentor. Mike and Martha.
Thanks a lot, Mal. And there are similar programs to expose prospective doctors to work in rural areas in other states. The University of Minnesota offers the Rural Physician Associate program.
Medical students train under family physicians in rural areas, and so far 40% of program graduates go on to practice in rural areas.